Honorable Chairperson, distinguished guests, a very good afternoon and greetings from Bangladesh, and thank you to the authority as being I'm here today. My topic of presentation is the real challenge to address female sexual dysfunction to menopausal women. Well, there's a marked decline in all the sexual domains like desire, arousal, orgasm, satisfaction in both women and men as they grow older. Menopause is a milestone, so withdrawal of hormone exacerbates the sexual dysfunction to women, and that becomes so dramatic. That is the challenge. The prevalence of female sexual dysfunction in menopause is being recently published in the Climatric 68 to 86%, which affects adversely the quality of women's life. The relationship even breaks up, but the irony is, and the sad part is that women suffer silently. They don't express and share the problem with anyone. Even in some communities, it is a taboo. So many women refrain from sex, and they think it's not good to discuss about the sex with even her colleague or even her peer. On the contrary, also the health providers do not ask, or even they are unaware of the issue, and they are very reluctant to discuss about the sex with the women. So the issue remains complex, unresolved, and keeping the female sexual dysfunction difficult to address. Well, very few women are complaining, but that is the tip of iceberg. Sexual behavior is controlled by a hormonal response with the network. Today we have heard a lot of discussion in endocrinology sex, that is neurological, psychiatric, local disease, deficiency of the hormones, biopsychosocial factors, relationship factors, and comorbidities, all are responsible for that. But nothing happens without desire. Desire is the main important thing. Again, the painful sex, it affects not only the desire, all the domains of the sexual cycle. So pain is the most important factor, need to be addressed. Women discuss a lot of their menopausal problems. I mean, starting from the hot flushes to osteoporosis, bone pains. But for diagnosis, history taking need to be very meticulous, and focusing, when we are addressing the sexual issue, we need to take into account her cultural, social, religious belief, personal relationship, and whether she has got other comorbidities. That is why Dr. Huang says that finding the source of the issue for a doctor is just more than the half of the battle. Yes, pelvic examination is very important. And while history taking, communication is the art. Unless we feel we make a good rapport with the women, they are not be open up. So we can't get the actual history, what she is suffering from. I already told that women are oblivious, they're reluctant, they're hesitant to talk, and that secret is every woman, especially in our country. So once we take the history, then we have to classify that what type of dysfunction she is suffering from, and for that we need to follow the DMS-5 classification. And that is nowadays is very simple, because the sexual arousal, sexual desire, orgasm are grouped into the female sexual interest. And of course the other one is the pain, penetrative disorder. So we can discuss, when we are getting all the information, we can group them: desire, arousal or orgasm part, and the pain part. So if we discuss about the lack of interest, that means desire, arousal, orgasm. So decreased arousal is common in menopause and beyond. Usually what happens, the desire comes first and then it triggers the arousal. But in menopause, we have to remember that menopause desire will follow the arousal. Aroused women can have the desire. And lack of orgasm occurs in unaroused women. So for a gynae, for a sex therapist, the most important part, the women need to be aroused for the pleasant sex. Why arousal is so important? If you look at the anatomy, we see that when the woman is aroused, the clitoris becomes long, erectile, sensitive, and lot of blood supply is increased over there, and the introitus become juicy, lubricants, and vasocongestion is there. So it becomes lubricated and elastic. That gives the pleasurable sex. So orgasm, when women are aroused, definitely she will feel the orgasm. But if she is not aroused, it is very difficult to get orgasm. Though it is very irony that women do sex even without have orgasm. Now if you go for the pain, dyspareunia, painful sex. So yes, we all know that withdrawal of hormone makes the vaginal wall thin, friable, less elastic, dry, and become very much prone to get mechanical damage during sex. So lubrication is the cornerstone for the good sex. If you go through the menopause, I'm not going through the details, just only one thing I want to point out. Yes, that is the reduced vaginal flow. The vaginal flow is so much decreased that there is no discharge, which is very important, and that's why diminished lubrication, which gives painful sex. And similarly, if you look at the organs, that is pelvic organs, you see that is the normal during the reproductive age. That goes to slower, smaller, drier, and the vaginal thickness becomes so thin. The vaginal blood supply becomes so less. So it is dry and dehydrated almost. So that is pathology we have to keep in our mind during the treatment. So now once we diagnose, what is the treatment? Well, of course, clinical examination is very straightforward. Minimum investigation need to be done to rule out any pathology. So once diagnosis is made, holistic and team approach is needed. Most female sexual dysfunction can be solved if underlying physiological and psychological causes are corrected, because emotion need to be most important part of having good sex. Yes, multidisciplinary team should be there. The gynecologist, psychiatrist, sex therapist, counselor, all of them come forward to have a good treatment. Strategy. What should be the strategy of the treatment? Well, that has to be focused to providing the education of the sexual behavior to the couple, how to do the response, how to do the performance, and how to enhance it. Using the erotic videos, books, providing distraction technique, distraction from the stress, anxieties, worries, use of some books, fantasies, show them exercise, show them the position, and of course the help of the sex toys, devices, they all are helpful in arousal. Some countries they're using the vibrators even, and there are a lot of vibrators, especially the suction vibrators. Women get really pleasure, and that is quite expensive. But bottom message is that pain relief is the most important part, because the single entity of the pain affect all the domain of the sexual cycle. Well, actually to deal the female sexual dysfunction, it's not a magic bullet to cure that. So according to all the counseling, we need to make them aware that lifestyle modification with maintenance of the BMI, regular exercise is very important. Of course, avoidance of stress, mental recreation, mindful meditation, acupuncture, all are very helpful. Self-confidence make you women to enjoy more sex. And women who are not educated, they feel depressed, lonely, they can't express their things. Positive attitude towards menopause. What is happening, what is the reality, we have to accept that. Relationship with the partner is the most important part. Women are not only the defaulter. And Massachusetts of the university, they said that 68% men, they are suffering from erection disorder in the later part. So you need to treat the co-partner, what is happening with the partner also. Yes, exercise, diet, relationship factors, comorbidities, attitudes, all need to be improved. Well, if we come to the medical treatment, which is our part, being a gynecologist, there are a lot of improvement recently to treat the sexuality of women. If we talk about the vaginal dryness, estrogen is the first choice. It has been used since many years back. But that is a very important, the local estrogen, not the systemic one. And with due respect with the medicine people, they are prescribing right and left the estrogen for the sexual dysfunction, but it doesn't work. So local estrogen is very important, along with the moisturizer. And if you give, the International Menopause Society recently said that if you give the moisturizer along with the estrogen local cream, that works synergistically and wonderful. Dihydroepiandrosterone, that is pyrethrin cream, today is Beverly has said so beautifully. We have heard that lecture. Is very effective because it is a androgen precursor, testosterone precursor, and it goes locally in the vagina and helps a lot. So pyrethrin cream is very popular. Unfortunately, in our country, it is very expensive. It's not yet popularized, and it is FDA approved. Tibolone, this is another hormone, but tibolone is being used by many years, but its effect on female sexuality has been challenged, though it has estrogen, progesterone, androgen. I can't go through all the details. I'm speaking only just focusing. Systemic ospemifene, just last 5 years has been come up in the market. This is a serum, non-hormone. It is systemic tablet which really helps in the vagina to rejuvenate it. And Botox, well, we have heard today in this morning that Botox is doing a lot of work and many patients are very much happy with that. But there's no randomized control trial, so we cannot recommend routinely the Botox. Laser therapy, evidence-based, and is very promising, no doubt. I didn't say here testosterone cream. Testosterone cream is coming up, that is also is helping, and this is not yet FDA approved, but it is in the market. The other drugs, non-hormonal drugs, that is fibinacin, 100 milligram daily pill, is very popular in USA. That is centrally acting, and they are telling that this helps in the arousal as well as orgasm. That is, sex interest is being increased. Viagra, sildenafil, well, we know that it is very helpful in male, but what about in the female? It has been tried several years together, but expected result is not yet found. So women are not that happy with the Viagra. Yes, testosterone I just told before, that is the key hormone of desire. Testosterone, we know that testosterone, oxytocin, melanocorticoids, dopamine antagonists, all are acting over the hippocampus, and it causes the desire and arousal. So that is the key hormone of desire and arousal. So it can be used if there's no contraindication. So 300 microgram patch or tablet or implant. But one thing is important, that if we give testosterone for 6 months and she's not responding well, then there's no point of continuing the medicine. G-shot, today we heard from Beverly just before this lecture over there. Well, G-shot is very popular in America, USA. Every clinic they're using that, but probably in this subcontinent, I don't know about Japan, whether they're using, not yet that popular. They're telling that if G-spot, they're injecting the PRP, that is plasma-free protein of the women over there, they increase the proliferation of the fibroblasts, and they revert back or rejuvenalize and they cause a sexual stimulation in the anterior part of the vagina. That needs also a huge multi-center study before recommendation. And bremelanotide, that is coming up. It is a huge research is going on. That is melanocorticoid receptor agonist and is under trial, seems to be very promising. And it not only for vaginal pain, it increases the desire, arousal, and orgasms. So, I would like to conclude, Chairperson, that yes, counseling is important, no doubt. Sex therapy has very important, no doubt. But female sexual dysfunction causes much sufferings to the women, menopause and beyond. It deteriorates the quality of life, even breaks the relationship. And women are suffering severe psychological depression. Self-reporting is very rare. And that is why history taking need to be very meticulous. It's not so simple as other diseases. I mean, you need to be very, very meticulous. And all the doctors need to be proactive to overcome these challenges. And International Menopause Society regarding sexuality has said any women who are coming for other diseases during menopause, it should be legitimate, the providers, to ask her, is there any problem with her sex? That would help us a lot. And the health providers and doctors, they should possess not only the necessary wide medical knowledge about all the treatment, they need to be empathetic and compassionate. Thank you very much.